All right. Good morning, Dov. Thank you so much for joining us. We really appreciate having you on.
Thank you so much for having me.
Absolutely, absolutely. So you're very, very experienced in the space. You have a lot of different roles in behavioral health. What drew you into behavioral health in the first place, and ultimately into kind of more of the financial leadership role that you're in now?
Yeah, so right out of my master's program in accounting, I started off in the nursing home space, was in the finance office there, and it was great. It was a good industry, but I felt like there's just more that I could do. Behavioral health is one of the leading issues in America right now, behavioral health and substance abuse. So, I wanted to do something that really could impact people and help people out in their time of need. And an opportunity came to get involved with NewVista, which is a behavioral health company based out of Ohio. And I felt it'd be a good opportunity to kind of explore it and see what I could do to make a difference.
Absolutely, absolutely. Makes complete sense. Makes complete sense. I think behavioral health is one of those, at least previously, I think it's getting its time in the sun now, but I think it's very, very overlooked in terms of the crisis that is facing the whole country.
100%. Like we always say, we take care of people in their most vulnerable times. When someone's going through a behavioral health crisis, it's a very, very tough time. And, we're there to be their support and be their help to try to get them the help that they need.
Absolutely, absolutely. So because you're in the financial space, I'll ask this. How do you approach building good financial systems that balance that strategic, strong growth with quality of care and patient care?
Yeah. So I can tell you when I came to Vista, one of the things that really, really struck me was, we are for profit, but everything was from the lens of the patients. When I worked in previous companies in finance, it really didn't make a difference if you're selling cars, you're selling whatever you're selling. It doesn't matter. It's just what the money we're making. But I can tell you, being part of this organization, we always are looking at it from the lens of what can we do best for our patients, and how can we make sure that they're getting the care they need. But at the same time, we have to make money and be profitable, because ultimately, if we can't pay our bills and pay our employees, we're not going to be able to continue to provide the great care that we're providing. So, what we try to look at is just strong financial principles, which I think is something that was lacking in the behavioral health industry. A lot of people were getting started, and especially in the substance abuse area, and there was just not a lot of focus on strong financial principles. And we do monthly operating reviews for all of our business units, really diving into what expenses are over budget, what expenses are trending higher. And, in behavioral health, most of the things are just really around labor, making sure that you don't have too much overtime, you don't have too much bonuses. It is a tough staffing environment. There's not a lot of people that want to work in behavioral health, and there's definitely a lot of challenges, but really just having good systems and good software that you can really monitor that, to make sure that, your hourly wages are not getting too high, your overtime is not getting too high. And really, the expense management is something that we spend a lot of time and energy on, just to make sure that we're producing the outcomes that we need to on the front end, and taking care of our patients. Also, we like to spend a lot of energy on having a nice therapeutic environment. Our buildings are very nice. When we go to, we do a lot of conversions, and we go to convert the buildings. We try to make them look very presentable, very nice, which I think also helps a lot with the patient care. And also, when you're going into the project, the more that you can do on the front end, it saves you money on the long end with all the capex and things like that. So it's definitely something we try to approach when looking at a new building and setting up systems. But labor management is the key to success, and from an expense perspective. And also having good data around your revenue, really understanding what is your payer mix, where are the patients coming from, where are your clients coming from. All those things really help paint a better picture, so that you can really predict, what your financial outcome is going to be at the end of the month. We try to look at mid-month, at the end of the month, just to get a full picture, so we can make good financial decisions. Do we need to spend a little bit more money here? Do we need to take a little, spend a little bit less over there? And that's kind of what we've kind of built to manage the program.
Yeah, that makes complete sense. It all comes down to having good data that you can actually trust, right?
100%. And that was one of the things we implemented, I think, last year, is just a dashboard.
Mm.
We've always had a dashboard, but we really, beefed up the dashboard. But there's so many different metrics to look at in behavioral health. So our first is just identifying what are those key metrics you want to look at on a daily basis, and then figuring out a way to consolidate those into one place. Every morning we get our flash report to kind of just see from a census perspective who's coming, who's going, and it's really having access to that data is super important to be able to make decisions.
Absolutely, absolutely. Yeah, if you don't have good data, you can't make good decisions no matter what, right? Even if you have all the experience in the world, if you're flying blind, it doesn't really matter.
100%.
Yeah, no, it makes complete sense. So what are some of the biggest trends that you're seeing? We can call them trends, we can call them shifts in the behavioral health space that you think leaders should really be paying attention to right now?
Yeah, I would say one of the biggest issues we're dealing with now is just getting authorization for care. I don't know if it's a new trend, but it's definitely got much more difficult in the past few months. The criteria, all the payers are kind of really cracking down on different criteria. Even patients that really should be in the program, they're denying it or delaying getting back to us, and then you realize you have 5 days uncovered. So that to me is right now one of I think the biggest challenge that we're facing is just being able to work with the different payers that are out there and making sure we get authorization for care. And I would say probably the second thing is just keeping up with the staffing environment. I think during COVID and post COVID, this staffing has been a huge challenge. I think it's gotten better. You definitely still feel the shortage on staffing.
Absolutely. And I don't know that the staffing shortage is going to go away anytime soon either. I think that's
No,
a
I don't
struggle
think
now
so.
and it's probably going to be a struggle for a while.
Exactly. And getting the people that really know, getting good clinicians that can provide good care, getting nurses that don't want to work in the big med surg hospitals and want to work in, a behavioral health setting. These type of staff they're hard to come by. There's not a lot of them. I think there's a national shortage on clinical staff. So I don't know what the future holds, but that's definitely a challenge that we're always facing.
Absolutely. That makes complete sense. So you've been with NewVista, I think, through a lot of growth and a lot of organizational shifts, right? What have you found is one of the hardest parts of growing your organization outside of course, recruiting?
Yeah, I would say I'll go back a little bit to recruiting, but not recruiting to the staff and the buildings, but getting a good corporate leadership team. I think getting true experts in the behavioral space are hard to come by, and we're very fortunate at NewVista that we've really grown a strong corporate team. And I would say we struggled with that for a couple of years, but now we have like a solid team that's been with us, 5, 6+ years. And with that stability and with those expertise, it's really allowed us to grow and expand. It allowed us to look into other states because when you have a solid corporate foundation, it allows kind of all the buildings to be running smoothly and allows you to kind of look at growth and expansion. But when you're struggling to deal with issues at buildings and you don't have the right expertise or people that are dedicated, you might find someone with all the expertise in the world, but they're not willing to roll up their sleeves and drive down to a building and deal with issues. The expertise doesn't really help you. So we're fortunate that over the past few years since I've been in the organization to really grow a strong team, and that's really allowed us to grow. And without them, I would say everything else is nothing else you can do. You got to have that strong foundation so that you can grow and develop the organization.
Yeah. And I mean, as an MBA, there's a very appealing part of that narrative to me of, it starts with good leadership. It starts with good corporate leadership, and then you can build good staff and good systems and good processes and be able to actually serve clients well.
100%. And with that, we were in the behavioral space. There's not a lot, in substance abuse. There's a lot of EMRs out there, but on the behavioral health side, they don't really exist. There's a few, but none of them are perfect. But again, with having strong leadership, we were able to develop our own EMR, and that's really allowed us to also grow into other states because we're able to monitor things a lot closer, a lot of the regulatory components, and really having staff that are experts in their craft allows you to develop things and grow, become a lot bigger organization. So that's been huge. And really, like you said, it all comes from the leadership. The owner of the company, that's what I think he prides himself on the most is developing people and building a tight family in the organization where we all feel like we're part of the New Vista family. And I think that's key because there's a lot of jobs out there. Everyone will jump for another dollar here, another dollar there. But if you really feel like you're part of something and you're part of a family, it makes you give 120% all the time.
Absolutely. And it makes you willing to stick out the lean periods too, which always happen.
100%. Because in behavioral health, there's always challenges. That's for sure.
Always, always, always. The challenge might be different every day, but there's always one.
Exactly.
Yeah.
One of our operators always says, this is one of my favorite lines he ever said. It was, "There's 100 blinking lights every day in a psych hospital, but only one or two of them will kill you." You know.
And so you should focus on that first.
Exactly.
I like that. I like that. That makes a lot of sense. That makes a lot of sense. I have to ask some of these other questions because I know you're not directly in marketing, but your decisions directly influence marketing. And we are a behavioral health specialist agency, obviously. So first one, I mean, obviously in some of the regions you guys are in, you're in a very competitive space. How does your team go about getting the best outcomes in terms of actual new clients in the door? Outside of course, basic word of mouth should always be the basis. But outside of that, what have you found is the most effective?
Definitely marketing is not my expertise. They just come to me to want to spend money, and I can
Exactly.
always make the decision. But I think it's really a couple of things. I think it's having good outcomes. Being a good provider is your best marketing strategy, right? If you have a good reputation and referral sources trust you, there's no better marketing than that. And really, doing what you say you're going to do, providing the referral sources. If they expect you to answer the phone in under 3 minutes, you answer the phone with under 3 minutes. It's really being that good partner because it's a partnership between you and the referral sources. But I think the other thing is not relying on one stream of how you're getting business. We have multiple strategies, whether it's boots on the ground, whether it's SEO, whether it's, media campaigns. Just having a full stack, I think, is helpful because sometimes the boots on the ground is bringing a lot of the business, and sometimes you have a downturn on that, and you're getting a lot from the website referrals. And then sometimes you have a media campaign that you might not see the fruits of that right away, but it gets that general awareness, going to conferences. These type of things, I think, allow you to kind of just be known in the market. So it's just really having lots of different tactics because you never know which one's going to bring success at this point in time, and it fluctuates over time. So it's just figuring out how to take your marketing budget and allocating it in the appropriate places and making sure you're touching enough places. But again, it really you can have the best marketing team in the world, but if you're not doing a good patient care, it's not going to help you.
No, absolutely.
I think one of the things we also did is just we were fortunate enough have different regions, so kind of centralizing the business development department was also, I think, very valuable because it allows us to kind of market NewVista as a whole versus just a singular facility. And I think that's also been very helpful for us as a strategy just to consolidate our efforts and have people kind of marketing regions and touching a lot more people.
Absolutely. Well, and it goes back to good corporate leadership, right? You can have good leadership if it's centralized. It's a lot harder to maintain a good leadership team across many states.
And back to data, right? BD data is, a lot of BD people don't like data. They just like,
Yeah,
bringing the cupcakes and the donuts. But, the really strong BD people really have an appreciation for data and have strong data to be able to really see where the trends are. Is this referral source dropping? Is this one, did we get two new referrals from this place? What do we do differently? So someone who's always looking over that data is definitely key for successful outcomes.
absolutely. Absolutely. I completely agree. And you say you don't know marketing, but that is the marketing playbook, right? Is you have to be in a lot of places at once because you never really know what's going to work. Even, I mean, we're specialists in this space. I can tell you three or four strategies that any, whatever ABA or addiction treatment team can work on that'll probably generate good results. But one region, option number one will work the best, and the other region, option number three will work the best, and another region, none of those will work, and we'll have to do something totally different because it's just different. You never know.
100%. It's always evolving.
Always, always. And then the last question is also towards the marketing, but what's one new strategy you all are considering in your business development marketing team?
I think one of the things that we do most of them, so like it's not too many new ones, but I think one thing that new thing we did in 2025 that we had never done was like streaming ads, like on some of the streaming platforms, doing ads on those for some of our product lines. I would say we did see some success in it. Like I think we saw some more patients, but it's hard to actually tie that in to direct success from that. But that was something we never really thought about in 2025. We started looking into and try to do some more of those type of streaming commercials.
Yeah, that's awesome. That's awesome. They're fun to do if they're executed right, and they have a lot of good impact on brand awareness, right? They're generally
Right.
not so good for actual leads that day.
Exactly. As a finance guy, I'm always arguing that part. but
I know.
but
I was gonna say your marketing guy probably said that to you while you were saying, why am I cutting this big check? It's always how that goes. Well, thank you so much for coming on, Dove. We really appreciate your insights and appreciate some of, frankly, I think some good advice for a lot of businesses out there to start listening to.
I appreciate it. And I'm looking forward to learning more about the podcast. It seems like it's very interesting and helping a lot of behavioral health leaders. So thank you.
Thank you. Thank you. Thank you.